Disconnect is now being recorded.
Again, welcome to our second virtual event in the ASTO Connect series on brain health. I'm Talia Sands, Director of Health Improvement at the Association of State and Territorial Health Officials, also known as ASTO. The conversation and cup of joe that you are about to participate in is a semi-structured conversation with a group of experts and includes your favorite warm beverage of choice or whatever hydrating beverage you want to have on hand. We will start with welcome and introductions and then dive into some presentations. So we'll take a look at the overview on this slide. We'll again start with welcome and introductions, move into a data spotlight from the CDC's Alzheimer's disease and healthy aging program. We'll then learn more about the happenings of Tennessee and Washington State as they work to implement the CDC and Alzheimer's Association's Healthy Brain Initiative Road Map. And then we'll open it up to questions from you and dive into conversation. Next slide, please. For those who are not familiar with ASTO, we are a national nonprofit organization that represents the health officials of the U.S. states, territories, and the District of Columbia. We have three core functions that are reflected in our mission to support, equip, and advocate for state and territorial health officials in their work of advancing the public's health and well-being. We are a leadership home for the health officials, we're a capacity building provider for their agencies, and we're an advocate and voice for state and territorial public health on Capitol Hill. ASTO's health improvement portfolio includes a focus on healthy aging, which is the inspiration for today's session. Next slide, please. Today's conversation and cup of joe virtual coffee chat will feature both national partners and state health agency champions discussing the use and value of the CDC and Alzheimer's Association's Healthy Brain Initiative Roadmap. We hope by the end of today's session that you will feel inspired to implement at least one action step from the roadmap and a commitment to learning more about brain health in your jurisdiction and how you can make an impact. We'll hear from the speakers that you'll see their headshots and mini bios on the screen. We'll start out with Chris Taylor, who is an epidemiologist at the CDC's Alzheimer's disease and healthy aging program. We'll then hear from Sally Pitt, the director of the Office of Patient Advocacy in Tennessee. And then we'll hear from Marci Getz, Director of Healthy Aging Initiatives, and Janna Bardi, Chief of Public Health Practice at the Washington State Department of Health. Following the presentations, we'll have time for conversation, but don't be shy to dive into the conversation now. You can type your comments and questions into the chat box throughout the session or jot them down so that you can ask them live during the Q&A portion. Next slide, please. To get us started, we want to do a quick poll of the audience to find out which frameworks that you have heard of for supporting healthy aging or brain health in your jurisdiction. The answers are up on the screen and we should have a poll coming up. All right, you see it there. So take a moment to share your feedback on which frameworks you have heard of: the CDC's Healthy Brain Initiative Roadmap, the AARP Age-Friendly States Initiative, the TIFA or Trust for America's Health Age-Friendly Public Health Systems Initiative, or other. Feel free to select that too and then type to us in the chat box. All right, I see some items in the chat box speaking about dementia-friendly America or dementia-friendly communities. That's great. Thanks so much for sharing. So we will move now into our first presentation. A key aspect of our progress towards improved brain health is data. That's where it starts. And we are delighted to have Chris Taylor from the CDC to speak with us about some of the data available through his agency. As you may know, CDC developed two modules for the National Behavioral Risk Factor Surveillance System, also known as BRFSS or BRFSS, both a subjective cognitive decline module, and a caregiver module. And these are intended to support our understanding of what is going on at the state and national level in these areas. Chris will talk to us about the data available to each state through the BRFSS modules. Health agencies have access to these data and the fact sheets that the CDC has provided, which can be used to build awareness and support within state health agencies or among other key stakeholders about the importance of brain health and things that you can do about it through the Healthy Brain Initiative roadmap. With that, I will turn it over to Chris.
Thank you, Talia, and thank you everyone for joining us today. It's a pleasure to be able to speak to such a great group. Next slide, please. And next slide. So as Talia mentioned, I'm Chris Taylor. I'm an epidemiologist with CDC's Alzheimer's Disease and Healthy Aging program. And one of our core functions in our program is we support two surveillance data modules within the Behavioral Risk Factor Surveillance System, or BRFSS. For those of you who aren't familiar, BRFSS is the world's largest continually conducted telephone health survey. It's conducted every year in all 50 states, the District of Columbia, and some territories. And it collects a variety of health-related data, collects data on health status, risks, health behaviors, and there are a few parts to it. There's a core part of it, and so those core questions are questions that are administered by every state, no matter what. So those same questions are asked by every state, and then there are optional modules that a state can choose or choose not to administer in a particular year, depending on what their needs are and how many questions they want to be a part of their BRFSS survey within their state. The two modules that we support, the first one is the cognitive decline module, and that is an optional module. So states can choose to administer that module if they choose. It includes 6 questions about what we call subjective cognitive decline. So the first question is, we ask respondents if they have had any memory problems or confusion symptoms that have gotten worse or more frequent over the past 12 months. And so we've learned from this module, looking at adults 45 years of age and older, that more than 10% of adults 45 years of age and older do report these symptoms of subjective cognitive decline. It's actually 11.2%, so about 1 in 9 adults 45 years of age and older. And we also know from this data that about half of those adults with subjective cognitive decline have some sort of functional limitation due to that cognitive decline. Either they've had to give up some household activities like paying bills, taking medications, cleaning, driving, or they report an impaired ability to work, volunteer, or otherwise socialize outside the home. We do know from previous research that subjective cognitive decline is a potential precursor to dementia, including Alzheimer's disease. Not everyone with subjective cognitive decline will go on to develop Alzheimer's disease, but many will. It's about 8% per year for adults 65 years of age and older. And though it's an optional module, with the support of the Alzheimer's Association and of course all of the great states who have worked to administer this module, for the years, data collection years of 2015 through 2016, this cognitive decline module has been administered to 49 states, Puerto Rico, and the District of Columbia. Additionally, we sponsor a caregiver optional module. It's a 9-question module asking people to identify if they provide care to a friend or family member with a health problem or disability. And then there are follow-up questions asking about, how long they've provided care for this person, how often they provide care, and the health problem or disability, which is the main reason the person needs care, among others. So that's a 9-question module. And for 2015 through 2017, for those 3 data years, That module has been administered to 44 states, DC, and Puerto Rico. And then I'm going to talk now, I'm going to walk through the website here. And so what I'm going to do is show you some of the resources that we've created and have made available for people to use with these data. So you can see here on the screen, this is our website at CDC. You can get there by going to cdc.gov/aging. That brings you to this homepage for the Alzheimer's Disease and Healthy Aging program at CDC. On the left navigation menu, I'm going to click on Data and Reports. And that brings us to this first page here, Data and Reports. And the first thing it mentions is the Healthy Aging Data Portal tool, which I'm actually going to do that second. The first thing I'm going to show is this table here under infographics. These are infographic products that we've created within our program, where we have for nationally, as well as for each participating state, we have created an infographic that describes the main statistical results that we have from both the cognitive decline module and from the caregiver module. So first, I'm going to talk about the national data for subjective cognitive decline. I'm going to click on this PDF here, the 2016 one for combined national data. And this is the infographic here. These are all in PDF formats. They can be easily printed and shared and distributed. And they're very graphic forward, so they're easy to share. If you want to share with a variety of audiences, it works with the public, it works for public health officials, it works for advocates. And you can see here the main statistic here nationally for 2015-2016, 1 in 9 adults 45 years and older are experiencing subjective cognitive decline. It talks about a variety of statistics associated with that. 40% of people with STD have had to give up day-to-day activities. Over a third say it's interfered with work. And down here in the lower left-hand corner, less than half of people with subjective cognitive decline have discussed their symptoms with a healthcare provider. That's obviously something we have to improve. I'm going to go back to that table, and I'm going to show you the caregiver module. And so what's two products, actually 3 products we've just put up on this website. Here you can see in these first 3 lines for African American adults, American Indian, Alaska Native adults, and Hispanic adults, we have infographics looking at those specific populations for caregiving. I'm going to open one of those up. So here you can see this actually on the screen is an HTML file. So this is on a web page. This is actually very easy to read on a mobile device like an iPad or an iPhone. And so it shows for among African American adults using data from 2015 to 2017, 1 in 4 adults are caregivers. And we describe who the caregivers are. We know 61% are women, 13% are 65 years of age and older. And for this one, if you would also like a PDF, up here at the top, right under the title, it says available for download. That will open up a PDF that, again, you can share like the other one I had shown. Going back to that main table page, we also have data for individual states. So if I scroll down to just a random state, I'll go down to, let's say, New York. And so for New York, we can see for subjective cognitive decline, again, this is just New York's data. So if you're from a specific state, you can see that. You can see they're each labeled. This has a big NY up in the corner, and it has the New York specific statistics for subjective cognitive decline. We also have those same statistics it's for caregivers, depending on if that state has administered the module in that year. I'm going to go back up to the page and briefly talk about the Healthy Aging Data Portal, which is that link at the very top. This is another way that you can get data that our program here at CDC helps collect. I'm going to do here on the left, there's a map, and as you put your mouse over each state, the state is highlighted. So if I were to go again to New York, click on New York, it will open up a page, and you can choose a category of statistics to look at for New York. So I'm going to choose cognitive decline, so that would be our data for cognitive decline for the most recent year. and then it'll take a second to load, and then I'll show you it automatically generates some figures divided by age group, and these are just for New York. And you can see there's several figures here, and there's a figure generated for each question that we've selected to include into this module. Additionally, if you would prefer, instead of a chart, if you would like a data table, there's an icon here in the corner. Instead of chart, you can click the table, and it's converted into a chart that you can abstract the data from yourself. And then finally, one more thing I'm going to show you is if you go back to our main page, Healthy Aging, and click on the Data and Reports menu on the side and click on the Surveillance button, this will bring you to a page. It gives all the information we have about BRFSS. You can click on looking at the Cognitive Decline module or the Caregiver module. And when you go into these pages to ask for more information, it talks about the history of these questions, and talks about the questions that are included, talks about which states are included, and talks about where you can get some more information. And actually, those 2 pages are being updated right now. They should be updated in hopefully this week or maybe next week. And so that data will be absolutely accurate and up to date, taking into account all of the data that we have on hand at the moment that we've analyzed. So we hope there's some very valuable resources for you, and I look forward to taking your questions later on in the chat. Thank you.
Thanks so much, Chris. That was wonderful, and I hope it gave all of you on the line some inspiration and ideas about where you can start to look at the data and see where the impact of brain health in your jurisdiction lies, and start thinking about where in the Healthy Brain Initiative roadmap you can find some action steps to make a difference based on what data you're seeing. So we will now turn it over to Sally Pitt from Tennessee. We are excited to welcome her back from the first session, our virtual open house in January. She's going to talk a little bit more about her experience implementing the Healthy Brain Initiative roadmap. She provided a snapshot of her work in the first event in the series, and we received a lot of interest about hearing more. So she'll share how Tennessee made a hub of online resources related to Alzheimer's and other dementias, and how she and her team made it happen. So with that, I'll turn it over to Sally.
Thank you, Talia. I appreciate that. Tennessee's work to implement the Healthy Brain Initiative roadmap action items would be actually impossible without the ongoing direct support from the national and our local Alzheimer's Association, ASTHO, CDC's resources, our department's senior leadership, and our department's Office of Chronic Disease Prevention and Health Promotion. Just for a little background, within our state, Alzheimer's is the 6th leading cause of death in Tennessee among those that are 65 and older. Tennessee has the 4th highest Alzheimer's death rate in America. By 2030, it is projected 28% of our state's entire population will be 60 and older. Tennessee did create a robust online Alzheimer's and other dementias website and developed, as well as conducted a live webinar for our department's public health professionals. The intent was to increase their understanding of Alzheimer's and other dementias as a priority public health issue and our role in addressing cognitive health and decline. So today I will be sharing additional information completed and planned action steps. So on the first slide, you will see the 2019 Healthy Aging Brain Brief and Strategies for Action, Alzheimer's and Other Dementias. The Brain Brief provides an overview of the scope and burden of Alzheimer's and cognitive decline within our state. The brief contains information on Alzheimer's disease and coexisting conditions, disparities among subpopulations, caregiver burden, modifiable risk factors to reduce cognitive decline, the importance of early detection and diagnoses, population health and recommended strategies, and strategies for action and partnerships. The brief identifies low or no cost opportunities to integrate dementia and cognitive decline risk messaging into our existing public health promotion campaigns. So the second part of this slide, you will see an introduction to the brief. This was done by our previous commissioner. I believe there were two critical actions that helped to assure the success of this project and to elevate the importance of brain health dementia within our department. Leadership support, gaining the health commissioner's support, including having him compose the introduction to the brief, and two, connecting brain health and cognitive decline risk factors into existing health campaigns that promote health and chronic condition management for people across the lifespan. The third slide you see is on tobacco use. The brief was intentionally developed to allow each explored topic to be an actionable stand-alone page. For example, if our public health staff are involved in a workplace initiative promoting tobacco cessation, they could print out this specific topic page, such as what you see on the screen, from the brief to find quick strategies to advance awareness between brain health and physical health by connecting dementia and cognitive decline risk messaging to our current public health campaigns on tobacco prevention. In addition to this slide, which provides the % of adult smokers by county, we also included Alzheimer's prevalence data by county. This allows public health staff to utilize county-level prevalence data and educational programs to inform and target public health programming and action. The fourth part of this slide is on economic development. The brief suggests ways in which public health can leverage collaborative partnerships with many sectors: economic development, healthcare, tourism, to raise awareness and inspire targeted action around Alzheimer's disease and dementia reduction. When our department looked at the portrait of today's unpaid family caregivers, we quickly learned from reports that caring for someone with Alzheimer's can have a negative effect not only on their health, but their employment, income, and financial security. Among caregivers for people with Alzheimer's who are employed, full or part-time, the reports concluded that 57% said they go in late, leave early, or take time off because of their caregiving responsibilities. 18% had to go from full-time to part-time. Also, we gleaned from reports that only half of employers have policies that support caregivers, such as flexible work hours, paid sick days, paid family leave, employee assistance programs, and allowed telecommuting. To assist our public health staff promote supportive communities and workplaces for caregivers for people with Alzheimer's and dementia, we developed this economic development section. As just mentioned, this page shares key data specific to the burden associated with caregiving and offers strategies on how our department can educate and engage the economic development sector to support caregivers in the workplace. So then as we move on to the second slide, we'll be talking about the Healthy Brain Toolkit for our public health professionals that we developed. So the toolkit was created for our public health professionals. The purpose of the toolkit is to have brain health education resources in an easily accessible location to educate individuals that our department serves, as well as our own public health staff. The toolkit is available in hard copy and online. Intended users are staff at regional, metro, and local health departments. The second part of this slide shows the table of contents. This is one page which highlights the contents of 3 of the 8 sections of the toolkit. It is a collection of public health outreach and engagement resources addressing a wide range of topics, from ready-made brain health messages that can be altered and edited for each county health department, to cognitive assessment during the Medicare annual wellness visit. The toolkit integrated best available evidence about brain health and cognitive decline risk factors. The third part of this slide shows how each section of the toolkit offers an introduction and suggestions on how to use the educational materials. This example, ready-made health messaging, is intended for our department's health educators, and the materials can be used to promote brain health either as an independent effort or by integrating into existing health promotion campaigns. Action steps our local health departments can take are also listed on the introduction to each section. So I would like to just in summary talk a little bit about our next steps within our department. Utilizing our department's 2019 state health plan, the department is conducting a deep dive into healthy aging with an emphasis on brain health. We are in the process of conducting 7 statewide focus groups with organizations, faith-based communities, and caregivers to learn about current initiatives, how our department can better serve and collaborate efforts, and how we can provide guidance, tools, and resources to assist efforts that are underway to improve healthy aging across our state. We are also administering the BRFSS Optional Modules for cognitive decline and caregiving. That concludes my presentation, Talia.
Thanks so much, Sally. That was wonderful to hear more about the work that you've done in Tennessee, and I can see a lot of states learning from you and taking a page from your book, perhaps literally. So we will now dive into our second state case study from Washington State. You'll hear from Marci Getz and Janna Bardi from the Washington State Department of Health. They are currently participating in the Alzheimer's Association and ASTO Brain Health Learning Community, where they're implementing priority action steps from the Healthy Brain Initiative Roadmap. Marci and Janna are going to share about how they were able to make brain health a priority in Washington, including getting leadership support and buy-in, working towards increased funding, and formation of an internal Department of Health work group. With that, I'll turn it over to Marci and Janna.
Thanks, Talia. Can we go to the next slide? And one more. Thank you. Good morning, or I should say good afternoon, everyone. And it's a privilege to have this opportunity to share with you today. And Janna and I appreciate you taking the time to be with us. In Washington State, much of the funding for public health work focuses on age and disease-specific preventions or interventions. Most do not address issues of healthy aging, brain development, Alzheimer's disease, and/or other dementias. Historically, our agency has been engaged in different areas of work addressing aging, but not in a strategic whole agency approach. There's been a focus both on the national and state level to have public health see our role in addressing health topics impacting older adults. We're fortunate to have frameworks and action items provided to us by Trust for America's Health, Centers for Disease Control and Prevention, such as the Healthy Brain Initiative, the Alzheimer's Associations, and many more. If you haven't done so, I encourage you to check out the Healthy Brain Initiative, as it provides 25 action items for states and local public health and their partners to accomplish. And it's laid out in a public health framework. Janna?
Thanks, Marci, and good afternoon, everybody. It's so inspiring to see the work from Tennessee, and we're just starting, so we are, it's really helpful to see all that they have done. Where we started, as Marci described, with the frameworks, we then developed this one-pager to make the case and to develop a common language for talking about healthy aging within the Department of Health. We felt it was super important to raise awareness and then think about the work and joining the partnership and what public health could bring to it. The goal of the one-pager that we developed was to do a couple of different things. One is to use data to make the case for the need for the work, to develop a shared definition of what is healthy aging, and then to garner the leadership support through clearly outlining our proposed work and the convening of a cross-agency work group, to use the framework and roadmaps we had planned, and to be specific about the staff time we needed in order to initiate the work, and then to identify specifically who the partners are at the state and national level that we're working with to do the work. Next slide, please. We are so fortunate to have a wonderful group of national, state, and community partners. And just to name a few of them, the National Alzheimer's Association, the ASTO Learning Community, and all the partners that come with them, CDC, and then in Washington State, the State Alzheimer's Association, the Department of Social and Health Services, Aging and Long-Term Care, and there are others that are working with us to bring more focus to aging. These strong partnerships, it was so great for us to just join a group that was already established and had already initiated a bunch of work and then welcomed us with open arms. It certainly made our work easier. We were the new kids sort of starting in on this work and bringing a new perspective to help, and they were just so welcoming. The Dementia Action Coalition for the state was formed to implement the Washington State Plan to address Alzheimer's disease and other dementias. So again, we have a state plan, and then the Dementia Action Collaborative is there to implement that state plan. And then another thing, the Dementia Action Collaborative, we call them the DAC, has been successful already in working with the legislature. They secured funding from our legislature last year to support 4 half-time positions in state government. Half of Marci's time is funded through that support, and it really creates the start of a foundation in which to do the work, not only within our state, but also within across state government with our sister state agencies. We feel like it's very important to have the dedicated staff time, and we've leveraged the half-time position in order to bring more focus to aging work beyond the Alzheimer's Plan and the work of the Dementia Action Collaborative. We are trying to bring more of a life course perspective of aging and healthy aging in addition to the other focus to our work. So Marci's half-time and then additional, potentially up to the rest of her position, at least another 25% of her position. And then my time are in kind from the department in adding on to the half-time position that Marci has. We feel like the dedicated staff time is really important, especially in the initial phases, to creating the structures that will support our work across the agency, for prioritizing the work, and for the way that we work with both staff who might already be doing some level of aging work, as well as with our leadership in discussions about the work now and the work going forward and creating those systems. That systematic approach, we're hoping to develop it in a way that it can be maintained over time and is not dependent on the people staffing these positions, specifically Marci or me being in those positions. We do believe that the position created for Marci, the Director of Healthy Aging Initiatives for the agency, is probably always going to be needed in order to keep the work moving forward and to look for opportunities to develop partnerships and monitor progress and much more. Since we are leveraging existing programs across the agency, similar to what Tennessee did, we really need somebody to continue to spearhead that, even when we get our systems in place that help support that work going on across different programs in our agency. Next slide, and I'm going to hand it back to you, Marci.
Thanks, Janna. Currently, we're working on 3 large bodies of work. First, we are working to standing up an internal Department of Health work group. And the goal for this work is to understand the messages and activities our agency is currently promoting, to leverage and align our work to create and further develop full agency focus on healthy aging. And then our second body of work is to conduct an assessment of touch points regarding healthy aging work to have a complete picture of how we're engaged in this topic. And some of our goals around that are to determine if there's, so we're trying to provide that. And then once we have that assessment done, we're going to work with Aging and Long-Term Supports Administration, who are a wonderful partner in this work, to determine if there are places that we could be collaborating now that we aren't between our agencies because we just don't know we're doing it, or one of us is aware and not the other. So just to give us more sense of what we're all doing. And then to compare and determine whether we can collaborate on messaging and to make sure that our messaging from one agency supports the messaging of the other sister agency, and to leverage the work of both of our agencies. And third, we are working on, we've spent the past few months talking with our partners at the national and state level and even within our own organization about the Behavioral Risk Factor Surveillance System, BRFSS, which you've already heard about this morning from Chris. And we've been talking about the cognitive decline and caregiver modules, which you learned are optional modules. So what we're doing with those is we're trying to understand past requests that were either granted or denied by our Department of Health, as we are the ones who run the BRFSS. We're exploring how to meet the Healthy Brain Initiative suggestions to implement the BRFSS optional modules. If you are familiar with the Healthy Brain Initiative, they're asking that states run the cognitive decline module in either 2019 and 2020, and then the caregiver module in either 2021 or 2022. And as you might understand, we're balancing both the importance and need for this data with other requests our agency receives to implement other optional modules that also provide important public health data. And knowing that we have to be cognizant of the length of our Washington State survey, so we're balancing that. And then we're also trying to ensure that our partners know the data that can be mined from the current BRFSS data we already have and assisting them with the evaluation of that data. And then I just wanted to point out to you that there's the picture on the slide is from the Alzheimer's Impact Movement. It's alz.org/facts. And I really encourage you to go there for your state data. They've just recently updated it, and so you can get some really important information that can assist. And I know Chris has also talked some about different data that you can obtain, so it's very helpful. So back to you, Talia.
Thank you so much, Marci and Janna. Their contact information is on the screen, as you can see. We are glad to hear about all of the processes that you have gone through already and that you're continuing to go through. You mentioned at the beginning of your presentation a one-pager, and I want to let the audience know that that one-pager is available for download in the chat box. So take a look there if you want to get a closer look and see if it's something that you want to model. So we're now going to move into our Q&A portion, and I'm going to turn it over to my colleague, Kelsey Donnellan at ASTO, to facilitate this section.
Thank you, Talia, and thank you to our presenters for engaging us in how to actually use the Healthy Brain Initiative roadmap. It's exciting to hear these examples and to get a sense of how you started and how you progressed over time. And so for those of you on the line, we want to ask you, what is the biggest asset in your state for implementing the Healthy Brain Initiative roadmap? Is it possibly funding, state staff champions, leadership support, communication campaigns, or other? If it's other, please go ahead and specify in the chat box. You'll now see a poll on your screen to indicate here. Wonderful. Well, thank you for completing our poll. And with that, we will open it up for questions. You can unmute your line or type into the chat box. You'll see the presentation go away for those of you joining us on video, and it will look like a Brady Bunch square of videos. Not seeing any questions in the, we do have one chat. For Washington, they're asking, how was the Department of Health selected versus the aging unit to leverage legislative support for a part-time position?
This is Marci. Can you read that one more time, your question, Kelsey?
Absolutely. It sounds like they're asking how the Department of Health was selected instead of the state aging unit to receive legislative support for a part-time position.
That's a great question, and I wish I could answer it more fully, but I will tell you that that we weren't part of the advocacy. The Dementia Action Collaborative is a public-private collaborative, as Janna had mentioned, with people from state agencies, volunteers, nonprofit, and they came together and they saw an ask that they needed positions to go across state agencies so that the Aging and Long-Term Supports Administration had other state agency support. So I know that they had wanted Department of Health to be able to implement some of the Healthy Brain Initiative suggestions for public health, but in terms of why other groups weren't selected, I really don't know the answer to that. I'm sorry about that.
This is Janna. Marci, can you add in, so there were 4 positions, I believe 3 or 4, and we got one, the Healthcare Authority got one, and the Healthcare Authority in Washington State is the state agency that purchases Medicaid as well as public employees purchasing and school purchasing of health insurance. And then where were the other 2?
Well, one was in long-term support, and the other one was with the agency that serves people with developmental disabilities. Thanks.
Great.
Good point.
Thank you. We have an active conversation in the chat box, and a next question for our presenters and perhaps for those of us on the line as well. How have local jurisdictions developed work plans and action items in coordination with state and federal plans?
This is Marci again. I would say that we are really new still to the table at this, but we have already been working closely with Seattle King County Public Health Department, who's doing a lot of great work around healthy aging. And so we've been in dialogue with them. And what we hope is once we have a better understanding of what we're providing at our own agency across the board, that then we can offer technical support and assistance to local health jurisdictions, such as with messaging or other things that can be done. So we're really in the beginning stages, but we definitely want to engage with local public health jurisdictions in our state. And again, we have been working closely with Seattle King County.
Piggybacking off what Marci shared, I will say that we've also seen other states work with their local health departments in tandem by either offering support financially or technical assistance as well. The roadmap itself is written such that it's for state and local health departments, and we at ASTO have engaged sort of a triad of people. So we have public health, state aging, and local public health in attendance at a workshop we did last summer with ODPHP, and that was really helpful at getting a variety of perspectives. So we've really seen it take form by doing a half-day or full-day workshop planning either by a federal sponsor or even within the state itself. We've seen both models work effectively. I'm seeing another question in the chat box. With the passage of the BOLD Act, is there any information that the CDC could share about potential future funding available to state health departments and others to support healthy brain-related efforts? I'm hoping Lisa or Chris that you might be able to help answer that one.
Yes, this is Chris. So the Bold Infrastructure for Alzheimer's Act was signed into law on December 31st, 2018. However, no funds were appropriated in the FY 2019 for implementation of the Bold Act. And so because that's authorizing language, it's not appropriated funds. So if funds are appropriated, then action would be taken.
Thank you, Chris. And I am seeing a few other questions about the BOLD Act related to timing, which I think you have answered there, that we won't have a proper timing until funds are appropriated for the BOLD Act. And in the interim, I'm wondering if those on the line can help us think about what is one key action step that state health agency staff can take between now and the next ASTO Connects in this series to implement the Healthy Brain Initiative roadmap.
This is Janna. I'll share that we really feel like the actions we took to gather the data to make the case were an important starting point for us. So the emerging increased number of the aging population and the impacts of that population were not well understood across our agency leadership. And in order to really sort of tap into what may already be happening in some of the programs that people didn't know about, because programs were, in some cases, have been recognizing this emerging issue and already addressing it. And so we really needed to bring together what's happening in programs with what leadership needs to know about and pay attention to in order to do a better job as a whole agency, and not just have programs doing it when they figured it out, but we didn't figure it out as a whole agency. So that assessment process, we feel like, has been really important, and I think it's proving out that it was a good starting place for us anyway.
Sally, do you have any recommendations for your fellow state health agency members as well? It looks like you might still be on mute.
How's that, Talia? Can you hear me okay?
I can hear you now, Sally. Thank you.
I apologize. So I can echo what's been said from Washington. I think you have to have the supporting data to provide to your senior leadership team. I recall receiving an opportunity within our Department of Health to do a strategic topic session related to healthy aging. What we quickly found was that on the topic of Alzheimer's and other dementias, that we did not really have a subject matter expert. When I talk about collaboration at the national level, we certainly had that level of collaboration. We had Molly French. If people do not know who Molly French is, they will after today's conversation, I'm sure. But Molly was very kind. Although she could not fly to Tennessee to do the presentation to our Commissioner of Health, along with senior and executive leadership team members, she did do a webinar. And so that was very, very helpful for us in laying the groundwork and the foundation for our journey on this path for looking at the roadmap and looking at actionable items that we could take within our state.
Great. Thank you. It sounds like in both Washington and Tennessee, those partnerships have been really key in leveraging the existing expertise, whether that's in the health department or with a partnership with the state aging unit. And I'm wondering if you could share a little bit with us about what was the easiest thing you've encountered and what was the most difficult. I think sometimes we get focused on the successes and forget that there were really big challenges that diverted course.
This is Sally. So I don't know if it was necessarily easy, but we did have great resources from CDC, the National Alzheimer's Association public health page. So I think maybe, if I can use it that way, the easiest thing was assembling materials and resources, evidence-based materials. I think the hardest continues to be in aligning efforts around brain health and showing our public health staff how that can be easily integrated into just current messaging, that we don't necessarily have to reinvent the wheel. It's just a matter of integrating current messaging around our big four leading causes of death in Tennessee: physical inactivity, smoking, obesity, and then substance abuse, that are modifiable risk factors for reducing cognitive decline, and showing them that they're currently doing the work across the lifespan, and showing them how they can integrate that messaging into their current health promotion campaigns.
And from Washington, we'd say the easiest by far has been working with our partner organizations and developing interpersonal relationships. As Janna noted, they've just been so welcoming and appreciative and supportive. And we've also worked with Molly French as well, just another plug for her. She was great. So, and I think the most difficult is that we're both fairly new to this body of work and piecing together the history so we know what we need to address, and acting as advocates. And the other piece is acting as advocates for the Healthy Brain Initiative as we become aware of competing demands for resources such as the BRFSS Optional Caregiver and Cognitive Decline Modules, just trying to figure out our role in as advocates and as members of a larger organization. Do you have anything to add, Janna?
No, I think you covered it. Thanks, Marci.
Thank you both for sharing those lessons. I think it's important to note that you both emphasized sort of the empowering nature of partnerships and working together to create those relationships based on existing expertise as well as existing resources. We do know it's limited funding and limited resources, but so many families are impacted and affected. So thank you for sharing your experiences with us. I'm going to leave it open for any other questions that might come through the chat box. We have a few minutes before we end. I do see one plug in the chat box here. With the imminent release of the Healthy Brain Initiative Roadmap for Indian Country, I hope several attendees will consider partnering with tribes in their states. So just a plug to continue looking out on the CDC's website that should be coming out shortly. And it does have cultural considerations available for specifically working with tribal nations and tribal serving organizations.
I'd like to just say, this is Janna in Washington. We're really looking forward to that publication. We have 29 federally recognized tribes in Washington, and we have really long-standing and good working relationships with them. And then just more generally, the Healthy Brain Initiative documents we have so far, they have been so helpful in providing a best practice document for what public health could be doing to further inform and educate and prepare and prevent cognitive decline and other dementias. So we're really looking forward to, as we convene our cross-agency staff group and get more clear on what our programs are doing, really comparing that back to the objectives in the Healthy Brain Initiative, because we know we're doing some of them, but to get a better sense of what we are doing so that we can then determine what we can do more and better, as Marci alluded to earlier.
Thank you for sharing that, Janna. And I'm going to turn it over to Talia to wrap us up for today's session.
Thanks, Kelsey. And thank you for joining the ASTO Connect series on brain health conversation and Cup of Joe event. And many, many thanks to our speakers, Chris, Sally, Marci, and Janna. Really appreciate your time and expertise and insight that you've shared today. We have a few wrap-up announcements, the first being that we invite you to join our final event in the series and Ask the Experts virtual moderated panel discussion on May 13th. We'll take an even deeper dive into how to implement the Healthy Brain Initiative Roadmap and improve brain health outcomes during that session. Please register through the link provided or find the series listed on the ASTO events page. As I mentioned, the session will be a live discussion with Q&A with a panel of experts, and they'll be answering questions that you submit when you register, so please be sure to register in advance so that we can incorporate your questions into the moderator question guide. If you were not able to join us for the first session in January, fear not, it was recorded and you can view it on the website. This is a really nice introduction to the Healthy Brain Initiative, the roadmap, and the forthcoming roadmap for Indian country. So please do take a look and watch it. In addition, our colleagues who work on early brain development have a webinar coming up at the beginning of April on lead exposure and the impacts on early brain development. So we hope you'll consider joining for that as we start to think about brain health across the life course and know that there are resources here at ASTO to help you along every step of the way. Next slide, please. On the note of the Healthy Brain Initiative Roadmap for Indian country, we're pleased to announce that ASTO, along with the International Association for Indigenous Aging, co-released resources for communicating brain and heart health among American Indian and Alaska Native communities and the connection between brain and heart health. The materials are on our website and you can find them in the link provided. There are posters, flyers, provider guides, radio PSAs, and short videos to come that are on the website. And on the screen here, you're looking at the vertical poster and horizontal poster, which are intended for American Indian and Alaska Native nations and tribal serving organizations. These materials can be distributed through senior centers, intertribal organizations, healthcare facilities, administrative offices, tribal newspapers and radio stations, and as mailers out into the community. We encourage state and territorial health officials and their agencies to take a look and work with tribal partners to disseminate these materials within the settings recommended and through relevant events. Please feel free to reach out to the ASTO team and the International Association for Indigenous Aging if you want to learn more. We're very excited about those being out in the public. Next slide, please. So thank you again for joining our virtual coffee chat. Thanks again to our speakers. Please do take a moment to share your feedback with us through the evaluation survey that is listed here and will be in the chat box. We really value your feedback and want to make sure that this was a valuable experience for you and hear what you're interested in learning about moving forward. So thanks again and have a wonderful rest of your day.